So good evening again. Make sure you put your name and campus in the chat again, you all. Put your name and campus in the chat. Getting everybody back in. So I guess I didn't factor in enough time for break because we literally just finished testing. So we'll push our break time to the end. So I do want to look at this week's information, so we'll be ready for next week. So we'll just push the rest of our break time toward the end. Again, put your name and campus back in the chat because this is a new Zoom. All right, so let's look and see where we're at. Of course, exams will be graded on Friday after the last class takes their exam. And after that, exam analysis takes place. Okay, let's see. We are in week 6, so we are halfway there. Just like that first exam, the last exam is week 10. I'm trying to share my screen here. So if for those of you that are taking more than one class, be thinking about what it's going to look like for you. Because more than likely, week 4 and 10 is if you have more than one class, they fall. Both exams fall in that same week. For some of you, it may even fall in that same day. So just be thinking about what that's going to look like. Let's see here. Okay, it's pulling up. So think about those things that as you move forward, we have the last exam, unit exam 3. Okay, I'm getting ready to share. And then, of course, you have the HESI. Let's see, here we go. So be thinking about those things that you have done that's helped you do well on your exams, those things that you have identified to help you identify those concepts that you need to spend a little bit more time understanding. So think about all those things that you've done. Okay. All right. So here we go right here. All right. We are in week 6. We just took the exam. Of course, you have your developmental paper that's due. Remember, if you have completed the same assignment or a assignment that is similar and it's went through that database, turn it in, which is, for the most part, everyone uses that same database. You need to make sure you update your paper. Make sure you use the latest references within the last 5 years. You want to go in and paraphrase because if you have a high plagiarism score, then that becomes part of your record. It becomes a negative thing on your record. So just make sure you go back in. If you have completed the same assignment and or a similar assignment, because some classes, sometimes things overlap. And if so just word to the wise, go back in and make sure you paraphrase again. Make sure you have the latest references and cite your references inside the paper. Give credit to where that information came from, even though, it may be something that we said. Sometimes we restate things and we say them differently. Please do that so that your plagiarism score will not be high. So then week 7, when we come back next week, we have a quiz. And then you have a discussion question. Make sure that you're responding, reading and responding by the due dates. And then we skip a week. We don't have a quiz this week, but you have these NCLEX questions. Make sure that you are turning in that highest score. Every point matters. So, you can take these NCLEX questions as many times as you like. You only need 25 of them. Make sure you're turning in that highest score. Commit to not turning anything less than an 80. Because remember, there's no rounding at the end. And then we have that last quiz in week 9. And like I mentioned, week 10, if you're taking more than one class, more than likely your unit exam 3s are going to be in that same week. Usually by week 9, sometimes at the end of week 8, but for sure week 9, you should be getting your HESI information and it's specific to your campus. So be looking out for that. Most of the time in the past, over the last however many years, HESIs are not given this time of night. So your schedule, be thinking about what your schedule is going to look like for week 11. If you have all night classes, go ahead and be reaching out as early as you can, finding out who your campus deans are because they coordinate that so that you can be identifying what day and time the HESI exams will more likely be. Sometimes Monday night classes, HESIs are on Fridays. It's campus specific. So just make sure that you've done everything so that you can get that everything arranged, work, school, play, whatever responsibilities you have. But week 11 looks a little bit different from the rest of the weeks. Again, if you have night classes, HESIs are usually not given this time of night. So make sure that you reaching out once that information comes about. It is campus specific. Each campus is different from when they actually have them. And again, too, week 11, if you have more than one class, all HESIs are generally given during week 11. So start thinking about what that's going to look like. Start having conversations. If you think you need to have one about what some options are, I don't know, but it's worth having that conversation. Again, reach out. If there are concepts, we have one exam and we have 2 quizzes left. Then you have the HESI. You reaching out if there's some concepts that you still, kind of, have a hard time understanding what it is. Delegation is heavy. So make sure that you're understanding those rights and understanding what you as a nurse can do. And then unlicensed personnel, they can't do that. So you wouldn't be delegating them a task. So I know the HESIs are really, really big on that for leadership HESI. So just make sure that you are looking at those concepts. Go back, start, commit to going back to week 1, looking at those classroom recordings, the exam reviews from the 3 of us, Martinez, Ford, and Tenza. Start looking at all of those, just, break it up because at the HESI, everything is going to be at one time. So make sure that you start now prepping for that. If you have not placed your name and campus in the chat, please do so because this is a new Zoom. For those of you that are just coming in, the exams, of course, the grades will be posted after the last class takes their exam, which is on Friday, and after the exam analysis takes place. All right, so let's move on here. Let's just check your knowledge here. Let's do a quick Kahoot. And like I said, we didn't get a break, but we'll push. I want to make sure we go through a certain amount of information before we actually log off here. Let me share my screen. So for this one, I won't say anything. I just want you to be thinking about what you know, what you understand, and be making notes about which concepts you need to start with reviewing first. Of course, you're going to review all of them. Okay, let me share my screen here. Okay. Log in at a minimum with your initials, Kahoot it 347008. And I will here. I said I was going to be quiet. Make sure that you're reading the answer choices. Interpret each word. Remember, one word can change what the entire message is saying. Wow. Okay, I'm going to be quiet. Okay, let's look at the information in a different way. And this time I'll we're gonna discuss it. Let's see here. All right, let me share my screen. And okay. So I do want to hear from you. It says, which of the following are needed to create a less stressful work environment? So let's look at things that match. That's going to have us to be not as stressed out. So tell me what you think. Tell me the colors. Which one should I select?
Red and blue. Everyone's writing in the chat.
Oh, okay. I can't toggle back and forth. Okay, thank you. So we got red, have equipment available for staff to get the job done. So I am needing to, it's not clicking. Maybe my internet. Clicking a little dots. Let me stop sharing and reshare. So a less stressful work environment. So we're not going to select anything that's not going to match us not being stressed out. So having the things that I need to do my job equals a less stressful work environment. I think I'm having connectivity issues, you all. I think I'm losing you all. Are you all still there? Can you hear me?
We're here. Well,
Okay.
Yeah, we can still hear you.
Okay. Yeah, something's going on. Okay. Now it's working. All right. Let me go back and share. So if they expect you to check blood pressures and you haven't been told to bring in your own blood pressure equipment, then you expect the facility to have it. So if you go down the hall and that's your task to complete for that day and you don't have it, that's going to create stress. You said blue, organize your shift, getting your report, making sure everything that you need before you go down the hall with that medication card. They have different type cards. Some have a large card, some have a little computer. They call them little cows and all different kind of little nicknames for them. But having all the things that you need and be thinking about, okay, well, this patient in room 201, they have to get prepped for a procedure. So thinking through getting everything organized. Is that it? Well, those are is that your final answer?
final answer.
Okay. Why would we not select the green one? What word made this incorrect?
Some.
Okay, exactly. So make sure that you're looking when you're reading your answer choices, making sure that the entire answer choice is correct. Because yes, this one word can make it incorrect. Because if we take out some, treat staff, including nursing assistants, with respect, then this will be a correct answer choice. But this some makes it incorrect. So this entire thing is not correct. So make sure you look at everything. And creating a chaotic environment, that doesn't match being less stressful. All right. Let's see. Okay, which of the following are needed to create a less stressful work environment? So someone come off mute and tell me which colors to select.
Blue and green.
Blue and green. We just said having that organized shift and also treat all staff. That's that word that makes this all the way correct. And is that it?
And yellow.
Okay. Because yes, creating that calm environment, it does matches having that less stressful work environment. What word in this one makes this incorrect?
Most.
Got it. Again, that's test taken tip. Make sure that the entire answer choice is correct. Okay, subjective and objective information. Where did we get our subjective information from?
The client.
Okay, so the subject, the patient, the client, the resident, depends on what setting you're in, but it comes from that person. So objective information, how do we get that information? So this is information that the nurse will gather. We use what to get this information, this objective information? We use 4 by 5 senses. We don't ever taste anything, but the things that we see, the things that we hear, that boom, boom, we're listening for the blood pressure, that boom, boom. We're looking in the dial to see where that needle, where we're hearing that sound, that love dub. We listen to the heart sounds. When we feel the skin, we change in a dressing. Is there odor or is there odor? So we're using 4 by 5 senses. These are things that we observe. And so, which one is this? Is facial grimacing subjective or objective?
Objective.
Is that something we observe?
Yeah.
Yes, we use our sight to see that this person is having facial grimaces. So we can document nonverbal and verbal information. Okay, here we go again. Subjective and objective. The person states, my head hurts. Is this subjective or objective?
Subjective.
Subjective. Do we observe this? Do we observe the person's head hurt? No, exactly. Okay. All right. Which of the following describes leadership best? We have to just select one answer. Which one would sum it all up?
The blue.
Yellow.
So we narrowed down to blue and yellow. So look back at it again and then tell me what's your final answer.
Yellow.
Why is blue not the answer?
Because they got most in there.
Exactly. Remember, the entire answer choice has to be correct. So that word most makes this incorrect. Okay. Before attempting to solve any problem, the nurse must clearly identify the real problem. Is this true or false? Or can we just go ahead and solve the problem without identifying what it really is? It's a true or false statement. Before attempting to solve the problem, we must identify what the problem is.
True.
And a lot of times when someone issues a complaint, it's really, most of the time, that's really not the issue. But after investigating and gathering information, we really understand, we narrow it down to what the problem really is. Then we seek those solutions. So identifying that problem first is going to be that first step. Okay, so this one says, move this little bar away. Which is the lowest level of needs, but most important? This is one of our theorists that we'll talk about, Maslow's hierarchy of needs. Which color should I select?
Red and green.
Red and green. Okay, I think when you all answered this before, someone selected self-actualization. And self-actualization is actually at the top. But if I can't breathe, none of this other stuff matters. If a storm has just come and I don't have a place to live, the rest of this stuff really doesn't matter. If I don't have food, these other things don't matter. So this question said the lowest level, but most important. Airway, breathing, and circulation is going to be most important. Which leadership style considers everyone and the task to be completed? So we got the team members, we have the patients that we're going to provide the best care for, and the care plans and the interventions that we should be doing to take care of them. Which leadership style considers all of that? Everyone and the task.
Democratic.
Democratic. Okay. Which leadership style depends on the situation? They've just sounded an alarm, impeding what bad weather is coming. So at this moment in time, we go into weather mode, crisis mode. It's hospital week, and so at this time, we want all the staff and the residents or the patients to come to the party. We're changing up based on the situation. Did I just tell what the answer? What's the answer to this? I think I told you the answer. What's the answer?
Situational.
Situational. So it just depends on what's going on. The situation is what type of leadership style is situational. That's in that they named that one right, spot on. They didn't try to give us a different word. Situational, it depends on the situation. All right. So this one, this leadership style, the leader is more focused on being liked by the team. And when that happens, patient care, that care plan, those interventions, that comes second. That's not even an issue. That's not even important at this moment in time because the leader is more concerned about the team being liked by them. So what happens, providing that best care, does not happen. Which leadership style is this?
Laissez-faire.
Okay, let's see. Yep, got it. Happy Hospital LLC mission statement will it let you know the colors of this? That should have said logo of the organization. Will that mission statement define the purpose of the organization? Will that mission statement tell a person why the organization exists and the services that they can expect?
Blue and yellow.
Okay. So blue and yellow, they're saying the same thing, right? It's just they're paraphrased, but they're saying the same thing. Because, for example, if I wanted to have hip surgery and the mission statement for Happy Hospital LLC says, hey, we provide surgeries one day, extensive surgery, all different types of surgeries. But if Happy Hospital LLC mission did not state that they provided surgery there, would I be trying to go to that hospital? Wouldn't go because I'm not going to get the services that I need. And so that mission statement, it does tells us why they are there, the purpose of that facility, why they exist, and then the services that they actually provide. To effectively function as a manager, as that leader, we need to have a certain skill set. What things do we need to be an effective leader, manager?
Blue, green, and yellow.
Blue, we need to be able to communicate, even if things are going wrong, problem solving. We need to be able to critically think. And then you say yellow, time management. You can't take 2 shifts to complete work that should be completed in 1 shift. Sometimes you'll run over, but we should be staying there every day over and over. Time management is very important. Patients getting ready for surgery. We haven't prepped them yet. They can't go to surgery. Everything depends on everything. And let's see. Yep. So that word not change that whole definition. All right. Are there any questions about those concepts? Let's go to our next set of information here. Okay, I think this is the one I want to show. So we're headed off to work. Off to work we go. So as you go through your continue to rotate through your different clinical sites, you do want to, be looking at what do they do in that place? I know, you have your objectives and things for that day, but what else? What else is going on in that facility? So that you can be considering, hey, is this a place I want to work at or not? What is their mission? What is their whole purpose for existing? So as you have your different clinical instructors, you do want to Establish those therapeutic relationships with them, because if you have not worked and you're going to start creating your resume, if you haven't already started creating your resume, more than likely those mentors doing those clinical rotations, that's going to be who's going to provide those references for you, because you do want to list, the different things that you're doing at the clinical sites on your resume. And, you list them as, that was your preceptor or, your clinical rotation. But we do want to establish a professional relationship with the mentor doing those clinical rotations. And, also think about what workshops or professional development, because, we're life learners, that we can partake in. Let's see here. Here we go. Again, some of this is the same information, just looking at it in a different way. So the mission statement, what do the mission statement tell us about the healthcare facility? It's the place that people go to get whatever services that they actually provide. It's that purpose, it's the why that organization actually exists. And leadership should inspire trust and produce change, even if something has went wrong during the shift. If we're effective leaders, the team members, they'll still come to you. They'll let you know good, the bad, and the ugly. And as a result of that, we can produce change. And sometimes good, the bad isn't, some terrible things. So it could be something like, for example, I know a thing that's always kind of trivial is those batteries, those things that operates off those huge batteries. No one wants to plug them back up. Well, what can we do to, keep the batteries charged? Because we can't use the equipment for the, different devices that we have if those things are not charged regularly, and those batteries are not readily available and ready to go once the battery that's being used has been drained down. Leadership is about helping others reach their potential while also ensuring that the team achieves the goal. We are there to take care of these patients, no matter, we don't have any biases, we don't have any we want to provide the same best care for everyone. So we're there to help them along their journey. So we talked about leadership skills of an effective leader. We have to be critically thinking all the time. This is just something that we'll be thinking about throughout your shift. Be effective communicators, making sure that what we're communicating is correct and is specific to what we're talking about, that patient in room 201 versus the patient in room 202. Managing our time, making sure that we're completing tasks in a timely manner, that we're not running over shift all the time. And there are sometimes in emergency situations that things will come up and then, you'll run out of time. But time management also includes knowing when to reach out and ask your leader, hey, I need some help here. I got this going on, I had this going on, and I need some help. And then, of course, problem solving. And problem solving, sometimes it's just going up there, filling the water pitcher up or the ice pitcher up yourself for your patient. Sometimes the problems are not anything big. Usually they're not. But nevertheless, to be that effective leader, we need to be problem solvers. As a leader, you want to create a less stressed environment. What should we do? What are some things that we should do? We want to treat everyone with respect. We can agree to disagree, but we want to get back to, is this the care that we should be providing for this patient? Or what we're doing, is it this facility's policies and procedures? Do these policies and procedures align with the Nurse Practice Act? And so we want to treat everyone with respect. We can voice our differences without being aggressive and belittling. We want to create a calm environment. We want to organize our shifts. And once you get to your place of wherever you decide to work, you'll get your little routine down. And so as things come up, you'll be able to pivot and just keep on moving without losing much of your time. But having that organization, having your pens, having your equipment, everything, all of those things, they do matter. It may seem minute, but it does matter. We talked about the different leadership styles, situation. It depends on that situation. If a person, we're going in to do an assessment on our patient. The patient's in pain. There's a bad odor in the room. They hear all different types of alarms and everything going on. They're not going to be paying you any attention because based on the situation, they're in pain. They're focused on getting pain relief. They're focused on, the odor that's in the room. So Democratic considers everyone, the team, the patients, and everyone, of course, while abiding by rules and regulations and not violating HIPAA. We talked about laissez-faire. It focuses more on the leader being liked. So there's disregard to policies and procedures and taking care of the patients. So we talked about Maslow's hierarchy of needs. So know where each of these, how they fall, but the bottom layer, the lowest level is most important because this person, if we're not breathing, the rest of these things they don't matter. And then it builds. But this right here is also true about this. If you're not having any problems breathing, your shelter is fine, you got food, and you can go up the little ladder here. But a storm can come, something can happen. And therefore, that unmet need creates tension. And so we go up and down. This just depends on what's going on in your life. How they say life be lifing. If things happen, so we can go up and down at a moment's notice, and no one is exempt from it. But know that airway breathing and circulation is going to be essential, even though it's on the bottom, but the other parts rely on those things being taken care of. If we have a patient that is hearing impaired, so the patient in room 201, they are hearing impaired in the left ear. Which ear how should we be speaking to that patient? Which ear should we speak in? Should our voice be raised or normal tone? So tell me, let me hear from you. The person's hearing impaired. Tell me about it. Should our voice be raised or normal tone?
Normal tone.
Okay. If the person is hard of hearing in the left ear, should we be speaking in that ear? Or should we be speaking to the right ear on the right side?
On the right side.
Okay. So, and vice versa, if they're hard of hearing, and most of the time people will tell you, I can't hear on this side. So they're already telling you, hey, and most of the time they're reading your lips. We don't speak louder because when we get our voices are raised, it distorts because they already have that hearing problem. So they're hearing with less, of a sense. So, that raised voice distorts it. And usually they want you to speak on the other side. Nonverbal and verbal cues, we can always include nonverbal information in our documentation. Because like I said, we're going to use 4 of our 5 senses. We're not going to ever taste anything, but we can document those things we see. Facial grimacing, or we can say no facial grimacing because that's what we observe. We're documenting that blood pressure. We're listening for the sound and we're looking on the dial. We're touching the skin, the skin is warm, it's cool, it's clammy. We're actually, our nose, there was an odor. There was not an odor. And if there was, describe what did it smell like. We can use measurements and of course verbal, that whatever that person states. And we always want to make sure that in our documentation includes and indicates that the person actually stated whatever we're writing. So it won't be like we're stating it for the person. So make sure you use your quotation marks. Nonverbal, we just talked about that. We're looking at facial expressions, body movement and posture, gestures, eye contact, in their voice. Make sure we use all those descriptive terms so we can get that picture of what that patient looks like and what was going on at that moment in time. We talked about Maslow's hierarchy of needs. Again, that bottom level is most important. That's airway, breathing, and circulation. And we can go up and down this triangle. If something happens, which leads to an unmet need, I may have to go back down. And once that need is met, then I can go back up. So Linenger is known for cultural care. I'm not sure why I have these two sides duplicated. Their lineager is known for cultural care. Paplo is known for that interpersonal relations theory, and we'll go in more detail about these two. But and then we have Orem. So we have Orem, Maslow, Paplos, and lineager. So Orem, she has these three different levels here, but the whole idea is self-care deficit. So something's going on where this person cannot or does not or are not able to meet the needs to take care of themselves. So self-care deficit for Orem. Okay. Oh, and I left out Rosenstock. Rosenstock. If a person does not believe, if they don't have a perception or understanding or a concept or feelings that the intervention that you're coming in and trying to do is going to do them any good, then they don't want you to even do the intervention. They don't want any parts in it because they don't believe that what we're talking about or the intervention that we're trying to do is going to benefit them. So that's what Rosenstock's theory is all about. Does this person have a belief that the health interventions that we're trying to provide, if it's going to help them or not? We talked about critical thinking. It is needed, and it is based on the nursing process. We need critical thinking. And just go back to the nursing process, that assessment, we can't get away from it. You know, thinking it through, evaluation, we're implementing that nursing process. But critical thinking is based on the nursing process. So we need to know the way that we gather information and what do we do with this information. First, we want to collect the data. We want to do it all in an organized way. Then we want to verify the data, because sometimes you'll collect information and there's information that's erroneous. It could be incorrect or information that you don't need. Then we want to put that information, once we verify that we have statements from everyone. Something happens, and usually they go back 3 shifts in getting statements because they want to get like a clear picture of what, or as a clear picture as you can of actually what actually happened. And so once we gathered all the information, we verified that we have everyone's statements, we have the video footage, we have the logs or whatever it is, we want to lay it all out. So we want to arrange it in an organized way to make sure that there are no gaps in the information. You know, we look at the information. Well, wait a minute. We should have 3 statements from nurses. We only have 2 statements from nurses. Well, who else worked that night or who else worked that shift? And so we have to go back and get that statement. So we collect it, we verify it, we lay it out and make sure we arrange it. That helps us to identify if there are any gaps, if we need more information. Once all that's done, we analyze it and then we test it out. Is it purposeful and outcome or goal oriented? So we do need to know these steps. First, we got to collect the information before we move forward with the other steps. Okay. So critical thinking, we have knowledge. And then, so for these right here, you do need to know the definition, but you need to be able to apply it to a situation or scenario. So knowledge, that's recalling things that we have memorized. Comprehension is a step further. We have an understanding of the concept. Then application, using what we know, and then analysis, we're breaking down complex parts into basic information. I think I do have some examples here. So knowledge, we are recalling what a lab value is. You know, the potassium should be 3.5 to 5.0. And then once, you know, we see a potassium level, we quickly recall, okay, well, I remember what it was, but this is normal. This is abnormal. This is higher. This is low. That's the comprehension. That's that step further. Once we get the lab value, we realize that it's abnormal. Well, is it high or low? Application. What does that mean? What do I do with this information? How do I care for this client? So if we get lab results back, we get chest x-ray results back, think about, what does this information actually mean? You know, if this person has pneumonia, more than likely what we're going to be doing, mention some type of antibiotic, maybe some respiratory therapy, some chest percussions, oxygen therapy, breathing treatments, and so forth. So you start connecting the dots. And then analysis. How does what I do impact this client overall? So we went in initially, we probably had runny nose, we probably had fever, productive cough. So if we're giving them these antibiotics, if we're giving them the oxygen therapy, the O2 saturation should come back close to normal, or if not normal. We should see the cough lessen. Things should improve. And then if they don't improve over time, then we realize we need to probably go back and reassess and see what else needs to be done. I'm going to pause right here. Are there any questions about any of the information that we went over so far? Again, make sure that you are going back today. Commit to going back. Classroom recording 1, 2, all the way up to today. Make sure that you're going back, looking at that. Delegation, understanding those rights of delegation. What things can we delegate to the unlicensed personnel? Be thinking about what your week 10 is going to look like, because if you have more than one class, more than likely you're going to have more than one exam that week. HESI weeks, all HESIs are usually given in that same week. If you have more than one class, start having that conversation with your dean. That week is going to be different. If you have night classes, HESIs generally are not given this time of night. Just throwing some things out there for you. Unit exam 3, if you think that exam needs to be proctored on campus, be looking at your schedule, because we do have to give that 72-hour notice to the campus dean. If anything comes up between here and the time we meet again, please send an email, text message, call. Please reach out. If you want to meet one-on-one to review anything, reach out as well. Have a good night, and we'll see you next week. Grades will be posted on Friday after the exam analysis and after the last class takes their exam. Quiz on next week, quiz 4.